In the know.
Welcome, I'm Miss Jill, and this is In the Know. Tonight we're going to be talking about something. We have some guests here to help us, but I just want to read a little something first. Tonight we are talking about something that affects a lot of people, some people right here in your own community. I want to just drop a couple of statistics. This particular topic that we're discussing tonight affects approximately 100,000 Americans. It occurs among 1 out of every 365 Black or African American births. It occurs among 1 out of every 16,300 Hispanic births. About 1 in 13 Black or African American babies is born with sickle cell trait. So that's what we're here tonight to talk about. Not the trait, but sickle cell, is it disease?
Yes.
So I know sometimes I hear it disorder, but it's disease, correct?
It's disease,
okay.
Yes.
So I'm not an expert, and that is why we have an expert with us this evening. So I do want to introduce our guest. This is Beverly Lymon.
Yes.
So welcome, Beverly. How are you?
I'm great, thank you.
Good.
And again, I'd like to thank you for allowing us to be here this evening.
It's a pleasure. Likewise, I'm glad to have you. And we have a couple people with you today on the panel.
Yes.
And who would, one of them look familiar, and that is, look at her, that is Patricia Wilkins-Smith. Welcome back.
Thank you.
And in the middle, we have
Robert Ward.
Robert Ward. Welcome, Robert.
Thank you for having me.
So, starting out a little bit, the statistics that I read, I know they're approximate, but do those sound, I know they sound alarming when we hear those, but they're accurate. They're pretty accurate, correct?
It is pretty much so accurate, but unfortunately, we really don't know for sure. Because of the fact that in so many states, we don't have the exact numbers.
Yeah, and that's actually when I was doing research, it said it could be many more. Probably not less, but much, much more due
Definitely.
to what you just said.
Correct.
So, Beverly, let us know a little bit about you. Briefly tell us what you do. Tell us a little bit about why we are here to talk about the foundation, and then we'll just kind of go from there.
Okay. I grew up, I have 2 siblings that had sickle cell disease.
Okay.
I had a sister and a brother both that had sickle cell disease, and unfortunately, they're not here any longer with us. And so we have a foundation at this point, and we named the foundation after my brother. And the foundation was named after him because I was coming back and forth from Dallas, and at one point I saw my sister when she was getting checked into the hospital, and a lot of the children was their parents wasn't there with them at times because they had to work.
Right.
And it kind of was alarming to me because they were in the hospital and they didn't have footies and things so on.
Okay.
So when I went back to Dallas, I discussed it with some of my friends, and so we came back and we were thinking of things we could do, and we decided to have backpacks and fill things up for the children. And we came back here in Fort Wayne, and we just stuffed them with things to keep the children preoccupied when their parents were not with them.
So you used the actual need that you felt and from your own personal experience to form the foundation.
Correct.
How long has the foundation been? When did this start?
It started quite some time ago. We've been doing it for maybe over a decade and a half or so, yes.
Okay. We'll come back to that. Robert, Mr. Ward, do you want to tell us a little bit about who you are?
Yes, my name is Robert Ward. I'm a 24-year-old nursing student here in Fort Wayne.
Nice.
I have sickle cell disease myself.
Okay.
I'm also an advocate for the foundation and for the disease.
Awesome. We look forward to talking to you, too. Nursing. That's awesome. What made you take that path?
Just growing up, I've been in the hospital many times.
Okay.
And it always piqued my interest to hear the nurses and doctors talk about the different surgeries that I need, the different procedures that I need. And I just always wanted to know what exactly was going on with my body.
So kind of the same, from the experience and what you felt made you want to get into that position.
Yes.
So that's awesome. That's great. We'll come back because I know we have some questions for you.
All right.
Miss Smith, how are you? Tell us a little bit about yourself.
I'm a nurse, and really, I didn't do a lot with this particular foundation. I was glad when Beverly reached out to me and told me what she was doing, and I got involved through her. But being a nurse and in a doctor's office, and I've seen many, many children come in and parents find out that their babies are born with the trait, and some of them have the actual sickle cell disease.
Wow. Beverly, with that being said, and when I was doing some research, because I didn't know anything really about this, I'm going to make myself just look some type of way and say that I didn't even know that it was mandated for babies to be tested. Is that correct?
That is so, yes.
Okay. And that's just in the United States, though, right?
Correct.
Okay. Yeah, I had no idea. And I mean, I also didn't know that this was something that you came in with, like you're born with this.
Definitely so.
So,
it's hereditary.
One thing that I ran across that I have to ask, so this isn't something where somebody is 40 and they don't feel good, and all of a sudden it's like, oh, well, you have this. Like maybe they missed it, or is that possible?
At this time, it is not. Probably many years ago, it could have been possible, but fortunately, I believe it was President Reagan that made it mandatory for it to be for children. That was back in 1983, if I'm not mistaken. From that point moving forward, for it to be tested. So most of the children from that point up until the present and moving forward on to be tested. And they should know whether or not they have the trait or the disease.
To catch it right away before they even leave the hospital,
Yes.
basically.
And so that's been an extremely big blessing for the parents, because when my mom and dad got married, they had no idea what was the disease, and many other people probably did not know, and that's where the disease continued to manifest.
Gotcha. There's definitely a lot to it.
Yes.
Can I ask a question real quick?
Sure.
First of all, welcome everyone.
Thank you.
And I had the privilege of knowing Tim Lyman, and Teresa. I went to
Thank
school
you.
with them. Awesome people, very, very sweet, and just, when people have to endure this, the other people around them don't understand what they really go through, and I know we're going to hear about that. But I have personally had to deal with someone that had sickle cell, and I grew up across the street from another person who had sickle cell, and kind of like Jill, it's one of those things you didn't know a lot about.
Correct.
But then I always noticed the way these people would move.
Correct.
And so I had this curiosity that I've discovered since doing a little research of the pain that was associated with it. I don't think people realize that. And so that's the heartbreaker, because you see these people that are so precious and just loving people. But each time I met and talked to either Teresa or Tim, and even the guy across the street, Marvin, I mean, they were always so extremely nice, smiling, never complaining, but probably in some type of pain. Right. So I wanna know about that, if you don't mind being a little bit transparent as we move through about some of the things that you have had to deal with. But that's one of the things I want to bring out, that we as people, we do need to be more aware and be advocates for sickle cell and understand it, so that we know how to treat people around us and be patient with people, a little bit more understanding with people that's dealing with sickle cell. So, so thank you for being here.
I love how you mentioned the educating, because I know the education is important to you as well, and educating the community or educating family members that are dealing with this. So tell us a little bit about how you use your foundation to educate.
Thank you. Thank you very much. I love you, and thank you for saying that about my family and my brother. I really appreciate that. I think the education is extremely important, and not only to educate the person with the disease, but it's also important to educate the person, the siblings as well. And I'm saying that as a personal testimony because of the fact that growing up with seeing another sibling have the disease, in fact, with me seeing two siblings with the disease. So we need to understand the pain that they're going through and the suffering. Right. And Robert has probably been at some of the meetings that we've had when we would have the meetings and talk to the people, the siblings that's going through the hospital, and then the other sibling would stand up and say how bad they felt for the one sibling that's going in and out the hospital, and then the other sibling would say, well, I didn't know you felt that bad, and then before you know it, the whole room is teary-eyed, and everyone is in the room crying, and I didn't intend at that point to open up that type of can of worms, and everyone is in the room crying. Then sometimes one of the parents is crying too, and but those type of moments need to come open so everyone can have the opportunity to just express how they're feeling. Right. And when you grow up, you don't have a sensitive stomach like mine. I grew up with many ulcers in my stomach and things of that kind. And I think it was more so because we just didn't talk much about that because my mom was so busy going back and forth to the hospital. A person with sickle cell disease, their pain can last from 1 day to 30 days. And Robert will probably elaborate on that. And the pain can be mild, and then it can affect any parts of the body. And the pain they have is so severe. I've heard women tell me that the pain they have, labor pain, is just a walk in the park compared to the pain they have. The pain is so excruciating, it's no way to define how severe the pain is. And let's keep in mind, they did not have any medication for people that had sickle cell until the past few years. So up until that point, the only medication they had for people that had sickle cell disease was just pain pills. And then many times when our sickle cell patients would go into the hospital, before the doctor would do any type of treatment and even put a thermometer into their mouth, they would tell them, I'm not going to give you any pain medication, but yet keep in mind that's the only medication that was out there for a sickle cell patient. Right. So I'm just wondering what type of oath that doctor took to take care of my sickle cell brothers and sisters out there. I just think it was some type of borderline malpractice, but I don't know. God forgive me. But getting back, back, I'm very sensitive about that. So, Robert, what would you say about some of the things you've been through?
As an advocate and a teacher to a certain extent of the disease, I let people know all the time that in 2017, a lot of people didn't know this, but in 2017, sickle cell pain was the second leading pain only after childbirth. And when I explain that to especially women that have children, they can feel for us and all sickle cell patients because they know how bad childbirth was. And for a young male or female to go through that pain, especially children, it's kind of crazy. You
talked about being young and being in the hospital. Did you, as far as when you talk about the pain, I know you obviously had pain at that age and at this age, right? Is it the same kind? Like, does the pain get worse? Is what I'm asking. As you get older.
I would say so.
Yeah.
Just because as I'm still young, but I am getting older, and my body can let me know. Once I get to a certain point, especially if I'm not strong enough in a certain point on my body, The pain definitely can get worse from when I was in my preteens, teenage years
Sure.
to now.
Sure, makes sense. Other than pain, like give us a typical, if you're having a very bad day, explain that day a little bit. As far as the pain and other symptoms that kind of take over, so we can kind of understand.
So with sickle cell, your body can tell the weather before you can.
Okay.
So if you wake up one day and it's raining outside and it's 30 degrees or below, your body will start aching before you even look outside to see what the weather is, or before you even turn the news on to see how cold it is outside. Your body will let you know. And from then, you just have to, all we can do is bundle up and try to stay as warm as possible.
Because you know
Yeah.
that it's coming.
And then from that point, either you can prepare as much as you can, but once sickle cell pain gets to a certain point, there is no return. The only thing to do from that point is go to the ER.
There's your description.
Yes, and so would you say, I mean, so from research, anemia, does everybody that have sickle cell have anemia?
Yes.
And so there's triggers. So I don't know, certain foods, certain situations, certain environments, temperatures, etc. So talk about triggers. What is a great environment for you, and this is comfortable and this is safe? What place is that?
So for me personally, my dream place to live is Texas, which I just returned back from Texas maybe 3 days ago. And even in February in Texas, it's been, I think the lowest I saw was 45 degrees. So going from a place where we see -5, -10 degrees to a place where 8 in the morning it's almost 50 degrees, that makes your body feel better. That makes your mental capacity feel better. It just gives us a certain type of hope to know that there are places where we can be more comfortable.
For sure.
But temperature definitely is a main trigger, at least for me.
Yeah.
Stress can cause a sickle cell crisis. Lack of oxygen, lack of nutrition. There's quite a few different triggers.
Maybe lack of water, because that
Yes.
dehydration is a factor. So for you, what would you say as far as a good quantity of water? Are you they tell us on a normal basis, okay, we need 8 ounce glasses of water. For you, do you need more than that, or is that sustainable for you?
Ideally, yes, it would be more than that, but I would be telling a tale if I said I
You
keep up with
stick
that.
to that.
That's hard to
On a-
do.
on a
That's
daily
very
basis.
hard to do,
Yeah.
I
Yeah.
think.
How about flying? Did you have any complications when you were flying?
Yeah, on airplanes is definitely a different type of environment. We definitely have to make sure that we're hydrated for one. We have to make sure we are covered, our body is covered, so that you go through different temperatures and different environments, that your body is prepared for that change.
And as well as the high altitudes.
Yes.
So when you're flying, would you tell the person when you're getting on the plane, the stewardess or somebody, would you let them know? Or, I mean, how does that part work? Because I would think they should know. You have to have certain things, like you just said, a blanket or whatever. You just have to pack it up and have everything that you need and just make it happen.
Yeah, sadly, it's a cruel world.
Yeah.
And a lot of people don't understand what we have to deal with and what we go through. And a lot of people don't even know what sickle cell is.
Yeah.
So if I was to tell the flight attendant or the pilot, say I have to have the plane at a certain temperature, or they're not going to care. So
Right.
we have to make sure we are taking care of ourselves,
Mm-hmm.
and we have to be prepared when we go into those situations.
Wow.
Wow. Yeah, you don't think about this. You mentioned something about it being inherited. So can we talk a second about the traits? Because I know it's a little confusing because having the sickle cell trait doesn't necessarily mean that your child will have it. Like it's something with the husband and the two. Can you explain that so that it's
Certainly.
Yeah.
It is a hereditary disease with the hemoglobin, the red blood cells, okay? Now, when we grew up, my mom was so conscientious with it, and we were well diverse about the illness. So if when we brought a gentleman home, my mom would always ask the guy, do you have the disease? And if he did not know anything about sickle cell, we were not allowed to bring that guy back to our home again. So what it means is that if the guy have the trait and I have the trait, we have a 1% out of 4% out of 4 of having a 25% of having a child with the disease.
both.
If we both
Okay.
have the trait. So my chances of getting married, I would make sure that guy did not have the trait.
Interesting.
And then if he did not have the trait, then none of my children would have the disease.
So how
or
would
the
somebody
trait.
know? How would I know?
Well, you know,
I mean, obviously I have a daughter, but how would a person know?
you could get tested.
Okay.
And then we do a lot of testing here in the Fort Wayne area, and we usually make it publicly sometimes when we do testing, or you can go to your doctor. Most doctors do the testing, and they do it free with your insurance and things of that kind if you haven't got tested already.
Gotcha.
So most people know when they're older in years if they haven't gotten their child tested at birth at that point.
Interesting.
So yes, it's very important to know whether or not your child have that. But people with the trait, some of the trait people have side effects as well. But unfortunately, with the trait people, it's no research out there. And some of the doctors feel that it's going to be another animal once they start doing some research on the trait people. Because keep in mind, they're just now beginning to understand a lot about sickle cell disease. We're very blessed. We have great pediatricians. We have Dr. O'Brien here in the Fort Wayne area, and we have a group of great doctors that work with our children. And you know him quite well, and you can testify on that. So we're very blessed, and we have a group of doctors here. I'm not going to name all the doctors we have for the adults. So we're very blessed now to have a group of doctors that work with our adults too.
And you have something coming up this weekend.
Oh, we do.
Right? Right?
Yes.
You just happen to have something going on. Can we talk a little bit about
Certainly,
that?
certainly.
Okay. And also, I think we have. Do you have a flyer? You said you wanted to.
Yes. Do you have a copy?
We're gonna.
Okay, sure. There it is.
Yep.
Okay, we'll be doing a blood drive here in the Fort Wayne area, and Miss Patricia will probably be going into more detail since she's our nurse
Okay.
here, and I'll have her going into the real
Okay.
reason.
And that is first before we get off that. What is that? Saturday, Sunday?
It's going to be this Saturday. The Timothy Lyman Sickle Cell Foundation. We're doing a blood drive here with the True Love Baptist Church. And did you? No. You want me to? Okay, yeah. Okay, we're doing the blood drive at True Love Baptist Church, and we feel this is a time that everybody can give back to the community. If you have a loved one out there, a friend, or anyone that have sickle cell, or just a great time to give back to people that have the disease, okay?
Okay.
And so it's going to be from 10 a.m. to 2 p.m. This Community Harvest Food Bank have partnered in with us, and they will be donating for the first 25 people 50 pounds of food.
Oh, wow.
That you'll have the opportunity to go grocery shop. We
Okay.
will be having 4 gas cards and the amount of $58, and because Tim would have been 58 years young next week. And then we have door prizes we're giving out. We have a lot of things. We're going to have some of our sickle cell warriors. They'll be there. thanking people, talking about their journey, and we're going to have a lot of music there. We have Snyder honor students. They're going to be there doing a lot of things, and we're just planning on having a wonderful time. But we won't be able to do this without the help of the community. So we're hoping and praying that the community will take part of this. Our original goal was to have 58 people here in the community, and I just don't think that's a large number
Right.
for Fort Wayne to step up and come on
I agree.
out and help us. So we need Fort Wayne to come on out and help us out and have 58 people to donate blood.
Do you want to tell what? Can you look into the camera and you can tell them that you would like the support and why it's important that we
Okay.
support?
Yes, okay. We need the help of Fort Wayne to come on out and help donate blood. If one person donate blood, they have the opportunity to save 3 lives. It's a painless procedure to go through, and it does not take long. So we're really hoping and praying that we can get Fort Wayne to come on out and help us out. So we're pleading for Fort Wayne to come and help us. It's going to be at True Love Baptist Church this Saturday from 10 a.m. to 2 p.m. So please come on out and help us out.
Great. And I know we have a copy of that flyer, so we will post that on our Facebook
Okay.
so that everyone doesn't have to memorize what we said. So we do have a copy of that. And I do hope the community comes out to support. Have you done this before?
We have,
Okay.
but this is going to be a winter blood drive, and the shelves are really low to empty in the wintertime. So it's really we're on pins and needles
Okay.
because it's really it's a challenging thing to do in the winter months, but the blood is so needed.
Okay.
And so we're just praying that everyone will come out and participate.
What was the participation like when you did it before?
We had the community involved. We were
Okay.
very much blessed. We always had it at
So it was good.
Yes, True Love Baptist. We have sandwiches that mission ribs, and then we have Fresh Market in Coventry, and we have all the restaurants in different locations are going to be community volunteering food and things like that. So we're planning on having a wonderful, wonderful time.
Okay.
So we just need our community to come on out and help us out. And my mom is giving up Saturday. She's going to be 91 years young.
Oh, bless her heart.
And she's going to be out there helping
91.
us out. And we're just planning on having a wonderful time.
So if she can be out there helping,
Yes.
we can all be out there.
And she's planning,
Helping.
Yeah, she's really planning on donating blood too.
Awesome.
So,
Awesome.
we're really praying that it's going to be a wonderful time.
That's great. That's great. Mr. Ward, if you wouldn't mind saying, when you say you're an advocate, did you have the support and the people around you when you were younger that were educated, that knew about, what you were going through? Or did you kind of experience where they weren't really sure either, like she was talking about most people?
Yeah, so growing up, elementary and middle school and most of high school, I got all my education from being in and out the hospital and talking to my doctor, Dr. O'Brien. And so when the Timothy Lyman Sickle Cell Foundation was founded and they invited me in, I felt honored because I felt I had enough information at that time to help the younger generation.
Awesome. Awesome. We love that. Well, we do want to thank you guys for being here with us. Did you have anything else?
I did.
Okay.
I wanted to know, are they doing further research? What type of studies? Because a lot of times you go to places and they're always talking about, do you want to give to this and donate and round up and et cetera? And I never, ever hear anybody talking about sickle cell or donating to sickle cell. So what is the research and the future of this disease? What is it looking like?
We're still trying to get a lot of research being done with sickle cell. From my understanding, they did find a cure. It was only $2 million for a person to get cured for sickle cell disease. So at this point, the insurance companies, from my understanding, many of them are not granting people to get cured since it's only $2 million.
Oh,
But
Wow.
dropping the bucket.
That's crazy.
yeah, drop in the bucket. But they are truly trying to do more research out there. We do have a great sickle cell foundation in Washington, the major sickle cell foundation. But it's a challenge because sickle cell still have the stigmatism as being an African American disease.
Oh, I see.
Unfortunately, with sickle cell, we get like 1/10 of the funding that many other organizations get.
Wow.
And it's very disheartening, and many people do not realize that. And so it's a struggle for sickle cell. It's a struggle for us to stay kill. And so we have to struggle.
So with that struggle, are you contemplating or thinking about anything in the future as far as being a place where people can donate, like the Red Cross, and we're talking about blood, but I mean, are there any talks of doing any funding so that further research can be done and money can be raised for sickle cell?
The national sickle cell in DC, they do a lot of that, and I believe that the NIH they do some of the they do some research on that too. But right now it's just we do a lot of locally. What we do is we try to do things to help our parents and our families out here in Fort Wayne is what I do, the Timothy Lyman Foundation do. And we try to keep them going and do things of that kind. We do a lot of different things. Just we have single families, single moms that's in and out of the hospitals. And sometimes they just need things from just to maintain every day that they're not eligible for different fundings. And so, and it's challenging if you got a child that's constantly in and out of the hospital, and you may not be eligible to get funding all the time or to get money for. So we try to do what we can do to help our families out locally here in Fort Wayne.
Okay, and this is my last one.
No,
and
no.
it's about employers. How are employers with this type of situation? Because if I'm a parent and I have a child with sickle cell, or if I have sickle cell, and I may need to be off work, how are the employers? Patricia, you seem like you want to say
Answer that
something.
a little bit.
Okay.
The FMLA will allow you to be off, but there's no pay.
It's no pay.
Right.
It's but they won't fire you for the time that you take off as long as you have that FMLA, but then you're not being paid for that time
Right.
you have off.
That's
Right.
not good.
So,
That's
wow.
not good. That's not helping.
Yeah, I know,
Right,
but
right.
that's just
Reality.
reality,
Yep,
the way
absolutely.
it is.
And
So you
Absolutely.
can take off as much time as needed, but that's just it.
And if you have a child that can have an illness several times a month, that can become very challenging. And keep in mind with FMLA is how many weeks is it out of per year? 6 weeks?
It has
A calendar year?
increased a little bit, so
Okay.
I'm not exactly sure of the numbers, but I do believe it's 12 weeks now
Per year.
per
cal-
year.
Per
I
calendar
do
year.
believe it's 12 weeks now per calendar year.
Yeah, that can still become very challenging.
Absolutely.
And it
Definitely.
is.
Yeah, very challenging.
Yeah, because there's one part where you can take care of someone else with FMLA, and then there's another where you can self-care. So when you have those two different things, but you may need it for both, because here's the thing. If you have someone, whether it's a spouse, sibling, etc., and you may be caring for them, then think about the wear and tear, because there's so much to deal with, especially if it's a small child. And then that wear and tear on you physically and mentally. And so I know you mentioned stress, at one point. And so there's all types of stress connected to it. So not just the stress of the pain, but then emotional stress and et cetera. And then the whole dating thing, it seems like it's so much.
Right.
It's so much
Right.
bigger than these 30 minutes.
It is. It is.
That, you know what I mean? So as our responsibility as a community, what would you say to us? What do we need to do, Patricia?
Number one, Saturday, as Beverly was talking about, we need our African American community to come out and donate. Yes, there are so many things that people don't realize. Yes, the Caucasian community can donate, but there's something in our blood and their blood when it comes to this. The red blood cells do not match. So we need to support our own with this blood draw. We need to get, as Beverly said, 58 people show up Saturday. It can be 108 people to show up Saturday,
Right.
because every drop of blood that is donated will be used. And I know a lot of times the African American community, their blood, they don't take it because they have high blood pressure, so they're on blood pressure medication, they're on heart medication. So, but go out and try. That's what we're asking.
That's
To
right.
go out and try. You don't know whether you're eligible to donate if you don't go out and try.
Right.
That's right.
Good point. Thank you for that. Before we head out, Beverly, what about your foundation as far as accepting donations or accepting help? If somebody wanted to do that, or if they wanted to find out more about the Timothy Lymon Sickle Cell Foundation, where would they go to do that?
Certainly. We have a Facebook page, and it has all that information, and it's Timothy Lymon Sickle Cell. And you can look us up on Facebook, and it has all our contact information.
Great.
And do keep in mind that we are a 501(c)(3).
Gotcha.
So whatever you would like to do, to volunteer, to donate, we would gratefully appreciate it. All the money stays here in Fort Wayne that you do donate, and we have a lot of fun with our youth. We're always doing things that are innovative, and we do things to educate our group, and we just do things to really help our families, and it would be most gratefully appreciated.
It sounds great. Well, we do want to thank you, all of you, for being here. Beverly, Robert, both of you, thank you, all of you, for sharing your, not only your knowledge, but your personal experience with us. I hope everything goes well this weekend. We look forward to hearing, and we do want the community, Neutral Voices asked the community to also come out. And again, we will post that flyer.
Thank you.
Before we get out of here, I also want to wish a happy heavenly birthday to your brother Timothy next week. And also I want to remind you all to join us tomorrow at 8:30, and to also remind you to always protect your mind. Thank you for being here.
Thank you.
Thank you.
Thank you, guys. A podcast by Neutral Voices Media Group. In the know.
Thank you. I
Both of them.